Today, let's talk a little bit about alcohol. Some people can drink quite a lot without feeling any significant discomfort. Some other people can easily have flushing of the face or throbbing headache. They might have an unsteady gait and cannot talk properly. Traditionally, people think that if you can tolerate alcohol well, i.e. you can drink without feeling much symptoms, that is an indication you're healthy. Is it really the case? So let's dive right into it. First of all, we have to understand a little bit about the metabolism or how our body handles alcohol when we drink. Well, alcohol is not digested. When you drink alcohol or any alcoholic beverages, the alcohol will be absorbed through your gut into the bloodstream. And following the bloodstream, the alcohol will go to the liver. The liver is the major organ that alcohol is kind of detoxify. Yes, we can consider alcohol as a toxin to the body. And our current evidence suggests that no amount of alcohol is beneficial. It used to be that people say that, moderate amount of alcohol prevent cardiovascular disease. But later study did not show that there is such a beneficial effect. So if you are not drinking, then try not to start drinking. If you have been drinking for some time, try to limit your amount. Now going back to the liver. Liver is the major organ where the body metabolizes alcohol. And in the process, alcohol is turned into something non-toxic and is eliminated from the body. But there is a certain capacity that the liver can handle this process. If one starts to have the habit of drinking, then the body will likely to respond in a way, having symptoms of flushing or having a red face, or reddening of the skin. You might temporarily feel warm because flushing is just an indication that your blood vessels relax and more blood will flow to the skin. Blood is carrying your body temperature, then you're likely to feel warm for a moment. And some people may have this throbbing headache, just like the pulsatile kind of headache, and you're likely to have slurring of speech and have some problem keeping steady when you walk. In fact, your vision is also affected. Your visual field is likely to be diminished. And those symptoms will only be gone when the liver handles all the alcohol that you have taken in. Now, what happens if a person continues to drink? With time, your body will develop a certain kind of what we call tolerance to the alcohol. That is not to say that your liver can handle the alcohol quicker than usual. Not at all. As I said, the liver has a limited capacity to handle alcohol. With continuous drinking, the body will react in a way that the symptoms of toxicity, which I described before, like reddening of the face, or throbbing headache, slurring of speech, unsteadiness, those symptoms are less likely to occur when you continue to drink for some time. At this stage that people say that you can hold a lot of alcohol, actually this is not something positive. That means your body's reaction to a toxic substance is diminished. Some people may have a false sense of security, thinking that, it's a good sign that my body is healthy, my body is handling the alcohol well. Not at all, it's not the case. In fact, not all the symptoms of toxicity develop tolerance. For example, your visual field will still be diminished despite the continuing use of alcohol. So if you drink, never drive. Even though you don't feel a thing, you don't have red face, you don't have slurring speech, you can walk steadily, still your visual field may be affected and your reaction time may be slow. So if you drive, it can be very dangerous even though you don't have those symptoms. So far we have just discussed about the short-term effect of alcohol on the body. We should not forget that in the long run, alcohol is going to cause a lot of other damage to the body. In general, alcohol has an effect on the body's genetic material. The repair mechanism of your DNA is affected by alcohol. As the cells in our body divide, there is replication or making of new DNA. sometimes errors occur. We have a repair mechanism which repair that kind of error. But alcohol is likely to affect this repair mechanism. That is to say, some damage, some error in DNA replication will persist. We speculate this might be the cause of a variety of cancer. Remember that alcohol is a proven carcinogenic substance. It definitely can cause cancer. With continued use of alcohol, a person's risk of developing like tongue cancer, cancer of the foot tip, cancer of the colon, the risks are increased with continual alcohol use. And alcohol can increase the risk of osteoporosis. That is to say, one has a higher risk of fracture. And of course, all of you might have heard that alcohol will cause damage to the liver, causing like fatty liver, cirrhosis, which is hardening of the liver tissue, and eventually liver cancer. And all this damage will be done without you ever noticing it, because these processes are very slow. And normally, people won't feel a thing until it is too late. On top of that, if you continue to drink after a certain period of time, if you drink more and more, you will be physically dependent on alcohol. That is to say, if you stop drinking alcohol, you have some symptoms, or what we call withdrawal symptoms. Typical symptoms would be like anxiety when you stop drinking alcohol, have palpitation, you are conscious of the beating of the heart, and some people may have shaking of the hands, and these symptoms are kind of tedious, and people will tend to drink more to obliterate these symptoms. Then gradually you are bound to drink more and more. Damage to your body will be even worse, and it becomes a vicious cycle. Okay, I think that's about it today, and thank you for watching. If you like this video, subscribe and leave your comments. I'll see you in the next one. Bye.